All right, guys, good afternoon. Dr. Stamper here, PetWow. Hope you're doing well. Today I want to talk about a little orthopedics. Why is my dog limping and when should I take him into the vet? So, limping, obviously, extremely common problem, probably in all mammals. I know I limp sometimes and I don't run to the doctor every time I limp for sure. Probably sometimes I should run to the doctor, but, I'm a vet, so we try to treat ourselves around here sometimes. So, kidding. Anyhow, I do go see my doctor. The limping's a tough one. I mean, obviously, if they're in intractable pain, really, really sore, had a major trauma, we want to make sure there's not something broken, fractured. You're probably going to bring him into the vet right away just because there's a major issue going on. But, most limping is not that way. Some limping occasionally comes and goes. So, in the really, really young dog, we definitely like to see limping as far as an exam because oftentimes they'll have growth plate fractures, what are called green stick fractures, which are very small. I don't know if I'd say the word micro fractures, but they're very small fractures. Also, small, young, particularly dogs, to a lesser extent cats, limping, especially if it's intermittent or if it's what we call shifting, where sometimes a dog or cat will limp on its front leg and then like the next day it's limping on its back left leg and then the next day it's the front leg. Those are oftentimes in signs of infectious arthritis where dogs get actually bacterial infections in their bloodstream and it's depositing in their joints, and so it'll hit different joints. Usually we'll see those in dogs under the age of a year, usually under the age of 4 months. So those kind of cases in young pets with limping, unless hey, he got his arm caught in the carpet, and if he limped for 2 days, then he's fine. Sure, I get that. But if it's a limp that's pronounced at all in a young dog, we usually like to see it. Of course, older dogs, once they're adults, running around, going crazy, playing, it's probably like people. If you limp for a day or two, but it's not affecting quality of life, most people probably aren't going to run to the vet right away. But certainly, if the limp persists day after day, certainly if it's getting worse, definitely we're going to want to evaluate the leg. I mean, in large and medium breed dogs, by far and away, we see rear leg lameness much more commonly than we do in the front, simply because they thrust so hard. So, ligament injuries, that sort of thing, we're always going to want to look at. And again, in the young dog, we're looking for infections and deformities, growth abnormalities. In the really old dog, again, all those orthopedic issues as well, arthritis, bone disease, that sort of thing. So again, it's all about quality of life. If they're painful, if they're sore, if it's progressing, if it's not getting better, or if it's coming and going, and certainly if they've been on medicine and they were doing well, and then now they're all of a sudden off medicine and they're limping right again. We like to recheck them for sure to make sure we either didn't miss something the first time or if something has developed over time. So, at PetWow, like most vets, we offer a vast, X-ray, full-on diagnostics, and most of the time we can answer what the problem is and go from there. So, hope you're well. Hope this serves you well. Thanks.